this is Sculptra, and there are some areas where you can't put Sculptra. You can't put Sculptra in the lips, and you don't put Sculptra in areas where you have a lot of muscle because it can bunch it up and cause clumping and bumps later on. So we'll go over this again, but this is not an area for Sculptra. Sculptra, yes, Sculptra, yes, Sculptra, Sculptra. You don't want to go too close to the lip, not in the chin. You can go along the jaw. So it's just knowing where to put which product where.
So this is a product, or it's something that you do?
It's a product which I'm trained to inject.
Oh, okay.
Okay, as you can see, when we showed some of the skeletons, you have to know your anatomy, you have to know where the nerves, the blood vessels, where the fat pads, where the bones, your bony landmarks. So,
She really looks a lot younger at the end.
yeah, well, Sculptra was initially
She's good at that, so.
made for the HIV patients 20 years ago for the lipoatrophy from their medications. And that's when all the initial studies were done. And so you can see the difference over time, especially in the nasolabial and the rounding in her mid-face. These patients required a lot of vials. This is just a strictly before and after. And these are a couple other models, but you can see, like you were talking about, the darkening. So we can't really inject bone, but for right now, this is the next best thing. In Sculptra, to be safe, you have to be down on the bone and the temples. And
You touch the bone?
oh yeah, you go down to the bone, you withdraw it, make sure there's no blood return, and then you inject small bolus. And then
Does it hurt?
you're very numb. You put numbing cream on for an hour, and then the mixture has lidocaine in it. And I can't use Sue as an example because she has an incredible pain tolerance, but usually it's tolerated. It's tolerated very well. I mean, sometimes she'll be.
I
They
think
touch
that's,
me
it
like
really,
that.
you know,
It really doesn't hurt.
You use the, you go in there and because I'm always so busy, I go and get the cream beforehand. And when I'm training my last client, which I have done, I put the cream on, I think I do it once with you. I had like cream on my face, I'm like, I just have some numbing cream on, so don't like look at me, don't, because it starts to melt a little bit.
It does.
But the thing is that I didn't feel a thing.
Yeah. So for Botox, the cream, it just needs to be on 20 minutes, but for Sculptra, an hour.
So here, the most dramatic changes though are really in the jawline and her neck.
Yes, yes. Because one of the things that, so you can see her temples, that has a pulling up effect of the whole face. It's sort of called the liquid facelift. And then we inject along this bone. And one of the things that we do is we pinch right here, and I see how much loose skin I get. And that gives me an idea. I'll put bolus along, just droplets like pillars along the jawline, and then do a threading where you're just doing thin lines of Sculptra in the deep fat in a cross-hatching manner. And you can see that this is a lot less loose.
Yeah.
And one of my favorite areas to inject it is right here, below the piriform aperture, because that brings the nose out, it brings the lip up, and it helps with these nasolabial folds. And I will do threads through the nasolabial. I won't go too close to this muscle, but I'll do crisscrosses. And after doing the full strength of bolus, I'll thin dilute it and do these threads. And now, one of the things that is new that we're doing is this crepey stuff here along the arm. And some people that are very crepey on their chest, as long as you're in the deep fat. And I know because I had a patient who had a big divot from a steroid injection, and I didn't know really what to do. I didn't do it, but I used Sculptra and it filled her butt, right?
Do you think you can film my divot from my horse accident?
Yeah,
Pretty good.
I've never seen it, but I definitely do. And I
So that would
really,
help with that, because part of my glute muscle disintegrated.
So I don't want her riding in the parade.
well, the lipoatrophy, the fat depression, it will, I'd have to look at it. But it definitely helped this patient. It didn't, she was very young.
Right.
You know, the kind that wears a bikini that shows that big divot. And I think a half a
I
vial.
have to tape mine all the time because the muscles are detached. I'm wondering if it would help support my muscle tissue. Could try.
I'm not sure, but I know the next indication, and I'm gonna do it anyway, is gonna be inner thighs. And I've been saying that for years. I'm gonna put this in my
That's right.
thighs. And then they just recently come out
Well, because if it works here, it should work here.
exactly,
It's the same,
extensor surface.
yeah.
That
Same
extends
same
to the
reason.
Yeah, I agree. So Sculptra, it's different, the way it works, it's not just a filler like Juvederm or Radius. Instead of just doing that windblown facelift and thinning, the one thing about this is I will say, especially because of the threading, it does stimulate collagen actually in the skin, and you get what's called the Sculptra glow. And it just makes your skin look really pretty. So it's a collagen stimulator. Average number of treatment is 3 over a few months.